I heard my best friend's baby has jaundice. Is it harmful? I'm worried. What is jaundice?
Jaundice is yellowing of the skin and eyes that is caused by a yellow substance in the blood called bilirubin. Bilirubin comes from the breakdown of red blood cells. Most babies have some degree of jaundice over the first several days of life, and it naturally decreases over several weeks. In a rare situation, very high levels of bilirubin can be harmful. Your pediatrician will monitor for jaundice closely to make sure it does not reach a harmful level and will treat it much sooner than that. Most babies have mild jaundice and need no treatment at all.
How do I know if my baby has jaundice?
Here, let me show you. For the first several days of life, your pediatrician will examine your baby to look for signs of jaundice. The yellowing tends to start on the face and eyes and moves down the body.
How come my best friend's baby has jaundice but mine doesn't? Are some babies more prone to jaundice?
There are certain factors that can make some babies more prone to jaundice. If breastfeeding is not going well, then babies may not be able to poop enough to get rid of their jaundice. Mothers with certain blood types may also develop antibodies that react with their baby's red blood cells, causing them to break down and produce more bilirubin. Babies who are born early also have a higher risk of jaundice for multiple reasons. Your pediatric provider may ask if you have a family history of jaundice because it tends to run in families, and certain conditions can cause high bilirubin levels.
It's hard for me to tell if my baby has jaundice. Is there another way to check?
Sometimes, jaundice is hard to see and can look different on different skin tones.
Your pediatrician may check for jaundice by using a tool called a transcutaneous bilimeter. This tool is pressed on the baby's skin and estimates the amount of bilirubin in the blood.
My best friend's baby had a blood draw to check her jaundice level. Why didn't they just use a bilirubinometer?
The bilimeter is not as accurate when the bilirubin level is high. Thus, when the bilimeter is reading high, your pediatrician may do a blood draw to confirm the level of bilirubin in the blood.
My first baby had jaundice, and our pediatrician kept asking us about the number of feeds and wet and dirty diapers. How come?
Babies get rid of bilirubin by pooping it out. The more your baby eats, the more your baby poops and pees, and the better they are able to get rid of the bilirubin. That is why it is important to keep track of the number of feeds and wet and dirty diapers for the first several days of life. After a few days, you'll notice that your baby's poop will turn from black meconium to yellow. This is a sign that your baby is clearing their bilirubin.
You should immediately see your pediatrician if your baby is not feeding well or is not making enough wet or dirty diapers.
What else can we do to get rid of jaundice?
If your baby has jaundice, your pediatrician may have you see a lactation consultant to make sure breastfeeding is going well. They may also have you supplement with pumped breast milk, donor breast milk, or formula if needed. This will help your baby poop and pee the bilirubin out. Some babies may need phototherapy, which is a special blue light to help get rid of the jaundice. Your pediatrician will work with you to determine the best treatment.
How about I put my baby in direct sunlight? Will that help?
Exposing your undressed baby to sunlight through a window may help decrease jaundice to a certain extent, but it can also cause sunburn, especially because babies are too young to wear sunscreen. You should not expose your baby to direct sunlight for a long period.
My baby has jaundice, but my milk has not come in yet. My pediatrician wants me to pump at home to increase my milk supply and supplement with formula in the meantime. But I can't afford a breast pump or formula right now. What do I do?
You aren't alone. Your medical team can help connect you to resources, such as the Women, Infants, and Children or WIC program for pumping supplies. Talk to your medical team for more information.
Most babies have some degree of jaundice, and it is often mild and requires no treatment. Some babies require treatment, which may include feeding, supplementation, and/or phototherapy. The best way to prevent and treat jaundice is close follow-up with your pediatrician to monitor the bilirubin level and ensure that your baby is feeding well. If your baby is not feeding well, it is not making enough wet or dirty diapers, or is looking a lot more yellow, call your pediatrician immediately for advice.